Hello, Rockdale. Sean Kimball here with your weekly COVID report. Today, I have Dan Morgan with me again. He is the director of the Emergency Management Agency here in Rockdale County. And he's going to tell us a little bit about the numbers and talk mostly about the vaccination process, who's eligible, how to make appointments, and a little bit about how to get some assistance to make those appointments. Take it away, Dan.
Well, new this week in vaccinations, a couple of things. GNR is opening a new Gwinnett Place vaccination site that is much larger than their Lawrenceville site. It's at the old Sears store at Gwinnett Place Mall. If you are making reservations or appointments for vaccines and you choose the Gwinnett area rather than the Rockdale-Newton area, make sure you're aware that is at the old Gwinnett Place Mall in the Sears building. It's going to be a fantastic facility, and when the vaccine supply increases, they'll be able to handle thousands of people per day up there. Right now, they're just opening as of Saturday, the 2nd of February. The other thing in vaccines is that you've heard numerous press conferences and town halls over the past week from the governor to our commissioners to Congress people. Vaccine supply is still low and is still sporadic. So we will continue to have issues with having enough appointments to meet the demand, regardless of where you're trying to get your vaccine shot, whether it's through the health department or through a private provider such as Publix, Kroger, or Walgreens, that nature. So we're not out of the woods yet from the pandemic, and we're not out of the woods yet with the vaccine supply to get it to the people who want it. Currently, we are still in phase 1A+, which is the very top of the pyramid. We are just barely hitting the 50% range of the people who are eligible now, and we will be a number of weeks at least before we get to phase 1B. And there again, dependent upon vaccine supply. The more vaccine, the faster we get through the phases.
What will be the determining factor for moving to the next phase of the process?
The way the state of Georgia moves from one phase to the other is in collaboration with the Department of Health and the governor. The state sets what phase we are in, so it will be an announcement from the governor's office that we are moving to phase 1B. It is not decided at the local level.
So Dan, when do we expect the next batch of vaccines to be released?
The actual delivery of vaccine to the state of Georgia or to the providers in the state of Georgia is still not widely known on the calendar. We know what we have been allotted and what we are expected, which is about 150,000 doses per week to be divided up amongst the providers in the state of Georgia. But any given week, we don't know if we're getting it or what day we would be getting it, which is the other reason that appointments seem sporadic, because they cannot release appointments for the following week on a given day because they don't know where they're going to have them. So this particular week, they opened on Wednesday. The previous week, they opened on Tuesday. We have no idea when they're going to open next week, and they still fill up within about 45 minutes to an hour.
So Dan, what would we say to people that may not be tech savvy and they're really having a hard time getting to somebody to even try to make an appointment?
Sean, that is a very real concern for a number of reasons. One, the just raw amount of people at one time who are trying to make appointments overloads the systems. It makes it very frustrating. Some of the sites, you have multiple steps, which there again slows you down of getting to that end goal of having an appointment. I would strongly suggest using family members. Some churches are helping, whatever mechanism, the most people you can have assisting you to do that is very beneficial to make these appointments. There's also a couple of sites on the internet that can assist you or point you in the right direction. There's also a new phone service that is available to the metro area that I will touch on that will actually alert you when appointments become open in your area. Then that way you can jump on the web and try to make an appointment because it's alerted you that the actual appointments are open. It does not make an appointment for you, but it just gives you a heads up when the appointments have opened up when somebody has vaccine. The main one you go to in our area is GNRHealth.com. And you can go directly there, and there's boxes to say make a vaccine appointment, and it will walk you through the steps. If there are no vaccine appointments available, it will tell you all the vaccine appointments are full, and it won't let you go any further. We do not use a waiting list. They have to be open, which means they have vaccine per appointment available and confirmed for the appointments to be open. Remember that if you live close to the county line or you're willing to travel, you can go to any county's individual website, DeKalb or wherever, and sign up through their site if their sites are open. You can also go to the State Department of Health, which is dph.georgia.gov, and there is an locator that shows where the providers are in your area. It does not show if they have appointments available, but also on that site are direct links to Kroger, Publix, and other pharmacies who are already approved providers that have their own sign-up portals. So on one page at the Department of Health site, you can click and see who has appointments available. There's about 5 on there. CVS, Walgreens, they're all listed there, and you can actually do a lot of one-stop shopping trying to find an appointment. Just remember that still the appointments are very scarce because of the quantities coming in to everybody. The other thing I'd like to, on the phone, if you text the word VAX, V-A-X, to 844-554-4024, it will ask you a series of questions. First one being what phase you were in, and if you were over 65, you were in phase 1A. And then it will ask you the county you want it to search for you. You put in your phone number. That way, from that point out, anytime vaccine appointments become available through GNR in Gwinnett, Newton, Rockdale, you will get a text alert, and you can jump on the internet right then and try to make an appointment. It does not make them for you, but it's a good tool to give a situational awareness of when stuff opens up.
So, Dan, you said 1A. We've discussed that a few times on last week's show, as well as a town hall virtual meeting we had with Dr. Williams. Can you explain to me real quick, and we'll finish this out, what is or who is eligible for 1A?
Currently in the state of Georgia, we are in phase 1A plus, which is healthcare workers, workers in long-term care facilities, first responders, and those who are 65 and over. That is 1A plus. Currently, those are eligible to make appointments for vaccines.
So for right now, no one else can get vaccinations.
That is correct. That if you make an appointment and you're out of that eligibility, then you will not be allowed to get an appointment and or a vaccine. The one caveat to that is if you are a healthcare provider or a caregiver to someone who is over 65, and that is being defined as you are their primary caregiver, not just delivering lunches on Saturday afternoon and spending time watching the football game, but you are there every day. They depend on you for their sustenance, for their livelihood, for their medical needs, whatever. You can be eligible to get a vaccine as a caregiver, but you need to make sure you make that clear in that application or that appointment process. I'd like to leave you with one last thought. Just because we have started the vaccination process, we are still extremely early in the overall plan for vaccinations. Remember, we're in 1A plus. There are 3 total phases in this vaccination process. So if you have been fortunate enough to make an appointment and get your vaccine, you still, because the vast majority of us have not been vaccinated, you still need to follow all the social hygiene rules. You need to wear a mask. You need to continually wash your hands. You need to practice social distancing because it takes a while for you to gain immunity. The other thing is they are still doing research whether someone who is vaccinated and has immunity can still spread COVID through contact. So we all need to take care of each other and look out for each other. So the vaccination at this point is not the end all to be all to get us out of the woods. Please maintain everything we have been doing, whether you have a vaccine or not.
Agreed. Thank you for joining us today, Dan. I appreciate your help. This information is very important, folks. Do us a favor. If you know somebody in that 1A category, ask them if they're having problems signing up. Give them a hand if you can. If you're tech savvy, if you just think you have the ability to give them assistance, please do so. Let's help Rockdale County stay safe and healthy throughout this pandemic. The more we do to help each other, the farther these numbers will drop. That's it for this week. We'll see you next week right here on the Weekly COVID Report.